Good evening. Before I formally begin addressing the public, I want to first address my members who professionally and passionately called in to advocate for the health and safety of kids, themselves, families, and the broader community. I know so many of you are afraid right now. You're afraid that because you spoke out, that there is a target on your back. You're afraid that retaliation is going to come. What I can assure you is that there is nothing illegal or against your contract for speaking out for health and safety. In fact, you are protected by various laws and contractual provisions against retaliation. If we don't advocate for health and safety, what can we advocate for? Good evening, Dr. Hazelton, Mrs. Cleary, and Mrs. Gaylord, Board of Education members. I'm speaking to you right now in order to advocate for a very difficult position. It is a position, though, that is rooted in science, that is rooted in health and safety for families, children, and staff, and yes, the broader community. It is a position ultimately rooted in love. COVID-19 is a global pandemic that has disrupted the lives of billions of people around the world. This is not an American problem, this is a global problem. Unfortunately, our country has not done what was necessary in order to contain the spread of the virus. And due to that fact, New Jersey, Union County, and yes, the city that we love, Linden, are deep in the throes of the second wave. I have already shared very specific data and information with the Board of Education members and the administration showing that Linden's even trending worse than the state. That's not surprising though, because Union County has been trending worse than the state. Union County has consistently been a number 2 hotspot in the state of New Jersey. When the average daily cases in the state were 3,000 per day, which were terrible numbers, that would equate to 30 for every 100,000 people. We were seeing multiple days of cases of 30 or more in the city of Linden with a population of only 49,000. Let me be clear. COVID-19 is here and there is community spread amongst us. The positivity rate for COVID-19 in Union County has now gone up to 9.9%. New York City just shut down its schools physically because the positivity rate hit 3%. Erie County, New York was shut down because the positivity rate exceeded 5%. We are sitting here at 9.9%. The CDC has also updated its guidance and the science has been updated. And it states 2 very important sentences now. The body of evidence is growing that children of all ages are susceptible to COVID-19 and, contrary to early reports, might play a role in transmission. The CDC also talks about whether schools should remain open or physically reopen. School officials should make decisions about school reopening based on the available data, including levels of community transmission. To everyone listening, there is rapid community transmission in our city and in our county. The threat of COVID-19 is real. The flu does not kill 250,000 people in less than a year. The flu does not overwhelm our hospital systems. Rahway Hospital, Robert Wood Johnson, has already been a divert status, meaning they've been full already. And we only have 2 major hospitals in this area, Trinitas and Rahway. The flu does not cause strange symptoms to last in people for months and months at a time without any resolution. In short, this virus is not the flu. The Children's Hospital of Philadelphia, one of the premier medical institutions in the world, renowned for its research, one of the institutions that they've been promoting in-person learning as much as possible, is now advocating for our area to please go remote because the spread of COVID-19 is too widespread. It's going to get in our schools. It's unavoidable. because the transmission rate is just too high. The caseload is just too high. If we don't transition to remote, they're promoting and they're stating that it will have terrible results that we will start seeing mostly in December. Even with all the best precautions in the world, in indoor environments, the number one indicator of safety is the level of community spread. You could have masks, 6 feet, in an indoor environment, this virus can and will spread. There's been a school in Union County that despite all the precautions, 23 people caught it in school. These are facts that you could all check for yourselves. And like I tell my students, I encourage everyone, please check the CDC website for what I just said. Please check the CHOP, the Children's Hospital Philadelphia, for what I just said. Do your homework. The CDC has also been very clear. While this virus affects all of us, disproportionately, unfortunately, staff of color and children of color are more susceptible to extreme negative results due to COVID-19. And that is just a fact. To the families, especially working families, and to my own members who disagree with me, and the families who disagree with me, I completely and emphatically understand. I too know how important in-person learning is. However, I want all of you who are angry with me to be able to stay angry with me in a few weeks. Meaning I want you to stay alive and healthy, and I want your children to stay alive. And I want our community to stay sound and healthy. And in order for that to happen, we must temporarily go to a remote setting. Truly, what I'm asking for is 15 days of remote. After Thanksgiving, we have soft quarantine. After Christmas, we have a hard quarantine. That's already built in. Let's just do the right thing for the health and safety of all and go remote and not have to wait until tragedy occurs. I also want to respond to something I heard at the board meeting. Like all districts that are district factor A or B, districts that serve, like I do, ESL students, working class students. Yes, we have our struggles. Yes, there are ways we can improve. There are ways our country can improve, but that's for another speech. I have been proud, though, to be part of a district that our graduation rate has consistently been extremely high. I'm an ESL teacher. The ELL graduation rate has consistently been in the state average, and this has been a model program that I've been proud to be in. Anna Skiba made that graduation rate possible. Bill Simonitis made that graduation rate possible. Kathy Burke made that graduation rate possible. Daniel Lee made that graduation rate possible. Edith Duckett made that graduation possible. And Fatin Sumreen made that graduation rate possible. We work extremely hard in this district to serve all children in Linden. Yes, there are ways we can improve and must improve. But I am proud to work with a membership that has consistently gone above and beyond to serve the children. School number 5 is a blue ribbon school because my members work extremely hard to service all children in Linden. I am not happy to have to advocate for remote learning, but I want everyone to be safe. And I'm urging everyone in the community, let's work together to crush the second wave, to end the spread of COVID-19 in our community so we can return to a sense of normalcy as soon as possible. Thank you, and have a good night.